Hi everyone, my name's Brittany. I'm going to be doing a neurological and musculoskeletal assessment on my patient today. How are you doing today, sir?
Pretty good.
Good. All right, I'm just going to take a quick look at his general appearance. Usually I would not actually state out loud what exactly I'm looking at for the general appearance, but grooming-wise, he looks fine. Personal hygiene, you would obviously smell for any type of body odors. His speech was normal when I did ask him how he was doing today. Can you tell me your first and last name, sir?
It's Ryan Johnson.
Can you tell me our president?
It is Donald Trump.
And where are you at right now?
Somerville.
Good job. So he is alert and oriented times 3. I'm going to ask you a few questions just to test your memory. I would like you to repeat immediately after me the numbers I'm going to give you, okay?
Okay.
3, 5, 7, 9.
3, 5, 7, 9.
Good job. I'm going to give you 3 words that you're going to repeat right after me as soon as I tell you them. And then at the end of the exam, I'm going to ask you what those 3 words to see if you remember them. Okay? The words are ball, pen, and cup.
Ball, pen, and cup.
Good job. All right, next I'm going to ask you a few math questions. Can you tell me what 2 plus 2 is?
4.
Can you tell me what 8 plus 8 is?
16.
Good job. And 7 times 3?
21.
Great. Next thing is a judgment question. What would you do if you found a piece of mail in the middle of the road that already had a postage stamp on it?
I would mail it back.
Good job. All right, next we're going to move on to the cranial nerves. First, we are going to test the cranial nerve 2 and 3, which are the optic nerve and the oculomotor. And we're going to do that by assessing Perla. Okay. Look at me, sir. His pupils are equal. Close your eyes for me. Open them. They're round. You can look straight. They're reactive to light. All right, you see the pen?
Mm-hmm.
You're going to follow this pen with your eyes. Do not move your head, okay?
Okay.
An accommodation. The cranial nerves 2 and 3 are intact. Next, we're going to assess cranial nerves 3, 4, and 5, which are the optic, the trochlear, and the abducens. These 3 assess the extraocular muscles. All right, watch my finger, and you're going to follow my finger with your eyes without moving your head, whatever direction they go, okay?
Mm-hmm.
Good job. Cranial nerves 3, 4, and 5 are intact. Next, we're going to assess cranial nerve 5, trigeminal, and cranial nerve 7, facial. I am going to take the end of this Q-tip, it's cotton tipped, and touch it close to the eye. And you can see just by touching his eyelashes, he does automatically blink. Next, I'm going to take the end of a sharp tip and actually elicit pain to his right hand, just a little. Hold your hand up for me and let me know as soon as you feel pain. Close your eyes for me.
Mm.
Do you feel pain?
Mm-hmm.
Okay, close your eyes, keep them closed for me. Now, next, I want you to tell me where you feel the pain and as soon as you feel it, okay?
Right there, wrist.
Okay. All right. Close your eyes for me, please. Keep them closed. You're going to tell me even left or right and where you feel it at, okay? And as soon as you feel it.
Right.
And where was that at?
Cheek. Left cheek.
Okay.
Forehead.
Good job. Okay, next we are going to assess cranial nerve 7, again, which is also the facial. Can you smile for me? Good job. And can you puff out one side of your cheek? Good job. Cranial nerve 7 is intact. Next, we're going to assess cranial nerve 8, which is the vestibulocochlear. I'm going to whisper 99 on both sides of his ear. So as soon as you hear me, I'd like you to repeat what I say, okay?
Okay. 99. 99.
Good job. Cranial nerve 8 is intact. Next, we are going to move on to cranial nerves 9 and 10. Cranial nerve 9 is glossopharyngeal, and cranial nerve 10 is the vagus nerve. Can you open your mouth? Just turn towards me some. Very wide. Stick your tongue out. Say ah. Okay. Soft palate rises equally, and the uvula is midline. You can turn back straight for me. Cranial nerves 9 and 10 are both intact. Next, we are going to assess cranial nerve 11, which is the accessory nerve. Can you shrug against resistance, please, with your shoulders? Push up. Good job. Down. Again. Good job. Okay, I'm going to place my hand on your cheek, and I want you to turn towards my hand. I'm going to push. You're going to feel resistance, okay? Push to the right. Okay, good. And again. Good job. Cranial nerve 11 accessory is intact. Next, we're going to move on to cranial nerve 12, which is hypoglossal. Can you please stick your tongue out? Move it left and right. Again. Again. Good job. No tremors. The tongue is midline and it's symmetrical movement. Cranial nerve 12 is intact. That is the end of the neurological assessment. We're now going to move to musculoskeletal. Okay, so first I'd like you to stretch your arms straight out in front of you. We're going to be testing active range of motion, and first is going to be abduction in the shoulder joints. If you could please move your arms out to the side. Good. Keep them just like that, and now move them up over your head, touching your palms. Good job. Now you can put your arms down. All right, I'm going to have you actually stand up. Stand directly in front of the camera. Scoot back for me a little bit more. Good job. Okay, next we're going to test external rotation. Can you clasp your hands behind your back with your elbows bent and reach up your fingers towards your shoulder blades, kind of like you're stretching, just like this. You stand up a little straighter for me. Just reach, pull up. Good job. Okay. Next, we're going to test the elbows. Can you reach out for me? Straight in front of you. Bend back in. All the way. Out. Okay, good job. Next, we're going to test the hands and wrist. First, and we're going to also test the fingers. So let's go ahead, and I want you to spread your fingers apart and then back together. Do that over and over again. That's testing for abduction and adduction of the fingers. The next thing I want you to do is take your wrist. Hold your hand out for me. Go up, back down, all the way. Good job. And go ahead and put your hands up like this. Straight and then down. Good job. All right, next we're going to move on to upper extremity muscle strength. Okay, we can actually have you sit back down for this one. We're going to first test your hand grip. I'm going to actually ask you to grasp my middle finger, both sides. Hold. All right, I'm going to pull away and you pull away from me, okay? Don't let them go. Good job. Great. Now we're going to move on to range of motion of the lower extremities. We're going to do flexion and extension of hip and knee. All right. If you could bring, yep, there we go. Bring your knee to your chest. Good. Back down. And now the other. Good job. Now I'd like you to rotate your ankle, and I'll actually demonstrate for you, just like this. Right ankle first, please. Good job. And now your left ankle. Okay, great. Now we are going to test for plantar flexion and dorsiflexion. If you could take your foot and actually bend your toes up towards the ceiling, your whole foot. There we go. Take your foot off the ground for me. Good. And now I want you to point towards the ground. Great job. Now I'm going to test muscle strength of the lower extremities. First, I'm going to do the hip. I'm actually going to put pressure right here. And I'm going to push down and you're going to push up, okay? All right, go ahead. Good job. That was the right leg. And good job. Left leg. We are also going to test strength for knee extension. So I'm going to actually place my hand. There we go. I'm going to push down. You're going to push up, okay? Go ahead. Good. And again. Good. We're also going to test plantar flexion with resistance. All right, if you could actually, we're going to hold your leg up just a little. You're going to point your toes towards the ceiling again while I'm pushing against you, and just resist, okay? There we go. And now the left. Good job. Lower extremity muscle strength was 5 out of 5, which is normal. Next, we're going to check for spinal curvature. I'm actually going to have you stand again. And if you could stand just like this. I am going to lift your shirt once you bend forward, okay? All right, go ahead and, let's see, put your feet together and bend forward for me. Bend at the waist. Good. So at this time, I'm just looking for any kyphosis, lordosis, or scoliosis. I do note some slight curvature, scoliosis. Is that part of your history, sir? Do you have a history of scoliosis?
Yes.
Okay. All right. Stand back up for me. All right. Next thing you are going to bend forward again. We're going to be checking for range of motion of the axial skeleton. So if you could bend forward and touch your toes. Good job. Now you can stand back up. Any pain noted with that?
No.
Okay. Next, we're going to check for spinal extension. I want you to look up for me, and I want you to actually bend backwards. Good job. Any pain?
No.
All right. Okay, so we're also going to check his gait, which is part of the neurological assessment too. We're going to do that by performing the heel to toe, also called the tandem gait. Okay, sir, I'd like you to walk in a straight line, heel to toe, and I'll tell you to stop. Okay, and you can start now, heel to toe. Okay, stop. Now I'd like you to pivot, just swing around towards me, and heel to toe again back towards me. Right now I'm just looking for any imbalances, unsteadiness. You can stop. Okay, now you can stand back towards the camera. He was very steady. His movements were smooth. His arms just swung very slightly and loosely, which is a normal response. Now I'm going to test for plantar flexion and dorsiflexion. You're going to actually walk on your heels first and then your toes, and you can just walk that way on your heels first, and then we'll walk back on your toes. So walk on your heels. Good job. Now turn around and walk towards me on your toes. He's very steady, no imbalances. Good job. Now you can turn towards the computer. Next, we're going to test for the Romberg test. Can you please place your feet together? Close your eyes. Put your hands down beside you. Good. So he stands, doesn't have any movement, no signs of ataxia, whether that be sensory or cerebellar, no signs of that. He did maintain his balance very well. Next, we're going to test for the pronator drift. Can you close your eyes, sir? And extend both of your arms in front of you with your palms up. Just like this. You can look at me very quickly. Palms up. There we go. Keep your eyes closed. Good. So we're looking for any deviation, whether the left or the right arm may go down. He did keep both arms very equal and at the same as when he started, level. Next, we're going to test rapid alternating motion. If you could place your hands on your thighs, palms down. Good. Now, I'm actually going to demonstrate. It's a little hard to explain. With the back of your hand, you're actually going to go back a hand and then to your palm over and over again, just like this. And I want you to get faster and faster. Okay? And keep going until I say stop. Faster and faster. Okay, good job. Normal response. Now we're going to test finger dexterity. If you could take, actually you're going to touch the tip of each finger to your thumb. So I want you to go just like this and get faster and faster. Yep, keep going. All right, now let's try the other hand. Good job. And that was a normal response. Okay, now we are going to sit back down. And we're going to now get started on the reflexes. So first I am actually going to test the superficial plantar reflex. And I'm going to do that by using a pen. I'm going to take your socks off, sir. I'm actually going to scrape the bottom of your foot. It will be a little ticklish, okay? Okay, great. So he did have a normal plantar reflex. The toes went upwards on both sides. Next, we're going to test the deep tendon reflexes. First will be the bicep. Hold your arm for me. Just relax your arm. And I'm going to do this using the bell of my scope. Okay, and we're going to try the other side. All right, normal response +2. We're now going to check the patellar reflex, which is the knee. Just relax, there we go. He had a normal patellar response on both left and right knees. And lastly, we are going to test the Achilles, which is the ankle. It's just at the back of the ankle. Good. Normal response to the right ankle. And a normal response to the left ankle. +2 for all deep tendon reflexes assessed. And that is the end of my assessment. Thank you, guys.